Lightwave-MoH Healthcare Solutions Limited, the lead company behind Ghana's national e-healthcare program, has strongly refuted claims made by the Minister of Health, Kwabena Akando, regarding the operations of Lightwave Health Information Management System, describing them as false and misleading. Addressing the minister's claim that Ghanaians' electronic medical data is being managed from India, Lightwave emphatically rejected the assertion. The company clarified that the Ministry of Health maintains full ownership and control of all patient data, which is securely stored in a centralized data repository in Accra, not outside the country, responding to allegations that it had completed less than 50% of its contractual obligations despite receiving 77% of the $100 million contract sum. Lightwave stated that the figures had been grossly misinterpreted.
Has their own data, and we trainer of trainers, and these people are like the first line of support when you go to the facilities, and they have access to the servers that they have in their facilities, and same the ministry. So I don't know how it comes back to say that we don't have data, we don't have access to the data. If we are able to know what is the meaning of that data they are looking for, because the data can be sitting there. If there is a system that runs the data and you are talking of that system is Lightwave intellectual property. So I don't know at which point the minister says they don't have access to the data, what he means.
These people you have trained.
Yeah.
Today, if I go to one of these hospitals and ask them to access the system and find my records, because I've been a patient there,
yeah,
they will be able to do it.
They should be able to do. And in fact, they do it. They print it, they send emails.
Okay.
Yes, within this year.
Because the accusation is that since September, since some meeting between your company and the ministry went badly, since then, you've kind of locked them out of the system and they can no longer access the data.
Kojo, if your media team would go to any hospital that is running, any hospital, and you ask them to give you, that is using the Lightwave and they are working, and ask them to give you your medical records, and they tell you they are unable to, let us know, because it's there, they do it every time. So I don't know which data the minister refers to. If it is about the source code, which came up in the meeting we had on September 3rd, that is Lightwave intellectual property. It does not belong to the ministry or the government of Ghana. But the data that the system used, the system used in collecting, that data is for the ministry and for the government of Ghana.
So what is this about source code? What came up during the meeting about source code?
Yes, in the meeting, they wanted the back end into the system. And if you are talking of the back end and you come and say you want the source code, meaning if you push Lightwave out with that information or that source code that you have, you'll be able to deploy the Lightwave system in other facilities. But that is not part of the ministry's agreement that we signed with them.
So what you are saying is that in this meeting in September, the government wanted you to hand over your intellectual property to them.
Yes.
So that they would have control over the software you've created, and you refused.
Yes. And prior to that, I think they have had engagements internally at the ministry with other agencies that we were unaware. As I had indicated earlier, we've sought for audience and we have not received any. Now, when the minister asks, okay, we are in the meeting, can you tell Lightwave? You said you don't have access. Tell them what it is. You have not been trained. And I told the minister, with all due respect, we have trained all regional and health information officers in the country for Ghana Health Service and for the Christian Health Association, Ghana. That's the CHAG. The Ghana Health Service one was done, the northern sector for the Ghana Health Service was done in Natamale Teaching Hospital. And then the southern sector was done in Ashanti region, Konfanochi Hospital. The CHAG also engaged. We engaged them, and we did one for CHAG in Bono region, Sunyane to be precise. So, and in all this, we have the ministry representatives and representatives from the Ghana Health Service. So it will be surprising for someone. So I just told him that it will be surprising for anybody seated in that room to tell us we have not trained them. They came back that they want access to the back end. And I told them, no, that is like you requesting for what is not part of the agreement we have with the ministry. So whatever we've trained you, if today, the hospitals that we have deployed, if an NGO comes and says, we are giving you 100 beds, you don't need Lightwave to set up those 100 beds in the system. If the government builds a new, or an agency come and build you a new building, you don't need Lightwave to come and put that building on the system for you. We have trained your users to be able to do this work. They only come to us when they feel they don't have the capacity. They haven't built capacity enough to do it. However, in trainings, which they will confirm, we go through all this with the facilities.